This is a clavicle. The clavicle is part of the pectoral girdle. Commonly, the clavicle is called your collarbone. The clavicle should fit between your sternum and your shoulder. So one end of this bone is going to be on the sternum, or the manubrium, and the other part will be in the shoulder region. This part of the bone is the part that will go towards your sternum. So we call this end of the clavicle the sternal end. This part of the clavicle will be in your shoulder, and we call it the acromial end. There's one other structure on the clavicle that we want you to know, and it's this one. This particular structure will always point inferiorly and towards your posterior. This structure is called the conoid tubercle. We will use these three structures to determine which side of the body this bone belongs to, because you have to know the difference between a right and a left clavicle. Remember, this side of the clavicle should always be on the sternum, and this side of the clavicle should always be in your shoulder. This part of the clavicle should always be pointing towards your back and down. This particular clavicle is a right clavicle. Let's compare it with this clavicle. This clavicle also has a sternal end and an acromial end and a conoid tubercle. But as you can see, this bone is the exact opposite of this bone. So this bone is a left clavicle. This is the second bone in our pectoral girdle. This bone is called the scapula. This is a posterior view of the scapula. When you look at this view, you can see that there are two pieces of bone that will stick out of the scapula and go towards the anterior of the bone. This section of bone that sticks out is called the acromion process. The acromion process, when the bone is in the body, will be the portion of the scapula that is the topmost or most superior part of the scapula. This projection of bone that sticks out is called the coracoid process. The word coracoid means shaped like a beak of a bird. I've had many students over my times teaching anatomy and physiology who would take the scapula and tap it on the table like a bird eating food and say coracoid, so that they know that this is the coracoid process. On the posterior of the bone, you will also see the spine of the scapula. This is a ridge of bone that goes across the posterior. It will be used as a reference point for the next two structures. The first is this one. This is called the supraspinous fossa. It is called the supraspinous fossa because it is superior or supra to the spine, and it is a depression which we call fossa. This depression is called the infraspinous fossa because it is inferior to the spine. If we look at the lateral portion of this bone, we will see this pit. It is the socket for the ball and socket joint of the shoulder. This pit is called the glenoid cavity. You will see on the edges of the glenoid cavity a rim around this bone. This superior part of this edge around the glenoid cavity is called the supraglenoid tubercle. This lower ridge is called the infraglenoid tubercle. If we turn the bone over and look at its anterior surface, we could see this whole anterior surface. This anterior surface is referred to as the subscapular fossa. The bone also has two edges, otherwise known as borders. The border that is inferior to the glenoid cavity is called the lateral border or the axillary border. Axillary because it is in the armpit region. This border is called the medial border or the vertebral border because it is closer to the vertebral column. How do you tell whether this is a right or a left scapula? We will use the spine of the scapula and the glenoid cavity to determine whether or not this is right or left. Remember, the spine of the scapula will always be to the posterior, and the glenoid cavity will always be to the lateral side of your body. This particular scapula belongs to the left side of the body.